Hi, this is Dr. Drew. Sometimes teeth need root canals, and in a different video we'll address what a root canal is and the process of that procedure. However, today in this video the aim is to talk about why teeth sometimes will need a root canal. And there's different things that can happen to a tooth that affect the nerve of the tooth, which is what the root canal treats, that can necessitate that therapy. One of the most common reasons a tooth needs a root canal is because the tooth has become necrotic, or the nerve has essentially died. And in that process, what happens is the nerve, vein, and artery that enter that tooth become infected, and that infection destroys the blood supply to that tooth, and no longer do immune cells or antibiotics that you are prescribed and swallow and to go everywhere your blood goes, they no longer enter into that tooth and cannot address the infection which is in that tooth. That's why a root canal is performed, and that procedure removes the nerve and the affected tissues in that area in order to take away that infection. Another most common reason that a tooth would need to have a root canal is what we call a pulpitis. That's extreme inflammation within the nerve of the tooth. The walls of the tooth are solid, and so there's nowhere for that pressure caused by that inflammation to go. Oftentimes that becomes very painful, and the only way to relieve the pain at that point is to remove the nerve by a root canal. So a tooth doesn't always hurt before it needs a root canal. A lot of times it does, but if the nerve is dead and you're in the early stages of infection, you may not even know that the tooth is dead until your dentist recognizes that by an x-ray or by some visual indications that he or she can see in your mouth. So again, the best way to be evaluated for that is to have your dentist take x-rays. There's various tests that can be done to determine if a root canal is necessary or not. Hope that helps. Have a great day.